Hello, coders. Good morning, good evening, good afternoon, all, depending upon where you're joining us from. Welcome back. Welcome back to another power packed CPT Guideline Mastery session with AMCI. How are you all doing, coders? And let me know in the chat how do I sound? Am I audible? Hi, Miss Mills. I can see my team here. Miss Mills, Miss Rosa is there in the chat. Hello, coders. How are you all doing? Okay, all right. Thank you. Thank you for letting me know. So, I hope you all are feeling energized, motivated, and ready to sharpen those coding skills today. Because here at AMCI, we don't just go through the guidelines, we break them down, simplify them, and truly make it in a form that truly you understand the logic behind them. All right, because confident coders don't just memorize, they master the concepts and the guideline. And each session, we take one focus topic, we dissect the guidelines, and work through practical examples so you can walk away not just informed, but also empowered. So stay engaged, keep your CPT book open, take notes, ask questions, and most importantly, enjoy the learning process. So let's learn, let's apply, and let's master the CPT one guideline at a time. So let's begin by reading out the copyright CPT Copyright 2026 American Medical Association, all right reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. The keyword concept FTR, CHON, AMCI, FAB 7, AMCI, ICD 10, FLIP, TAP, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials, and the credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. All right, so today's topic, it's an interesting topic, and this was one of the most on-demand topic as well. Most of you have requested to cover these topics in the previous surveys. So we are going to cover today the hydration, the therapeutic prophylactic diagnostic, injections and infusion, and the chemotherapy and highly complex biological agent administration coding. So in today's session, we are going to break down the hydration coding guidelines. We'll be discussing and clearly differentiate between what is an infusion, push, and injection. Also, understand what is an initial, sequential, and concurrent services. We are going to review the hierarchy, rules for the facility reporting, explore chemotherapy administration codes, and how they differ from the therapeutic infusions. And most importantly, apply everything through some real world coding scenarios. Okay, so before we begin, let's first understand where to find today's codes in your CPT manual. So you will find these codes in the medicine section of the manual, specifically under the subsection titled Hydration, Therapeutic Prophylactic Diagnostic Injections and Infusions, and Chemotherapy and other highly complex drug and highly complex biologic agent administration. So these codes are ranging from 96360 through 96549, and you will also find a few subsection under it. Okay, now that we know where to find them, let's begin the class with the hydration therapy. All right. Are you all ready? I know you all are. So let's begin by breaking down the hydration therapy in a simple way. Imagine, just imagine you had a severe food poisoning. I know that's bad, but just imagine, okay? You have been vomiting all night. You feel weak, dizzy, and completely drained. Now, you may even feel like you have no energy left. And at that point, your body isn't really asking for medicine. It is asking for fluids. And that's exactly where the hydration therapy comes in. Hydration therapy is simply the administration of the prepackaged fluids and electrolytes through an IV infusion to replace what your body has lost. So remember, hydration is not about drugs, it's not about antibiotics, it's not about treating an infection directly. It's about giving fluids that help your body to stabilize and recover. And the most common fluids you will see documented includes 0.9 percentage normal saline, D5W, which is 5 percentage of dextrose in water, the ringer lactate, pre-mixed electrolyte solution. So these are the common terms which we will see while coding hydration therapy. And these solutions just work to restore the fluid balance and correct the electrolyte levels. And always remember this key point, coders. These are fluids, not medication. And hydration is given when a patient cannot maintain the fluid level on their own. So, most common reason, as I said, it can be due to vomiting, dehydration, diarrhea, fever sometimes, or heat exhaustion as well. So, when you think of hydration, think it as fluid replacement, stabilization, and support. All right, now that we understand what hydration is, let's clearly review the CPT coding guidelines for hydration. Now, hydration is reported using the CPT code 96360 through 96361. So there are only two CPT codes for hydration therapy, and hydration infusion usually require a direct supervision. This means a trained clinical staff administers the infusion, and the physician must be available at the office suite or the facility. However, the physician does not need to be continuously present at the bedside because just after the initial setup, the hydration typically involves minimal patient risk and limited monitoring, right? So, now here's something important you must remember. From a coding perspective, hydration must run at least 31 minutes for them to be reportable. Okay? If the infusion lasts less than 31 minutes, you do not report the hydration. Okay, this is from the coding perspective. So, time truly matters here and always code based on the actual documented infusion time or the hydration time. All right. So these hydration codes are typically facility reported. And another important point to keep in mind that hydration is not separately reportable when the fluids are simply being used to keep the vein open. Yes, that's also known as KVO. So if the fluid is running slowly just to maintain the IV access, they are considered incidental and should not be coded separately. Yes. Also, hydration is not separately reportable when the fluids are given along with the chemotherapy or another therapeutic infusion, whether as a pre hydration, post hydration, or when a normal saline is simply used to mix or push a medication. All right. In these situations, the fluid are considered incidental to the hydration, and the hydration is included as a part of primary infusion services. So those are those are the hydration guidelines, and let's look into the CPT codes for the hydration. As I said, there are only two codes. One is 96360, which is a primary code, and that is for intravenous infusion hydration, initial 31 minutes to 1 hour. So you can see from the code language itself, right? It begins from initial 31 minutes to 1 hour, and you have an add-on code 96361 that is for each additional hour. And also, you can see the parenthetical guideline as well. Do not report the intravenous infusion for hydration of 30 minutes or less. That means a minimum 31 minutes of hydration infusion is required to report these services. All right, so keep in mind. Those are important guidelines. Okay, I can see a lot of people are joining now. Hello, everyone. Those who have just joined, welcome, welcome. All right, coders. Now that we have completed the hydration, let's move on to the next topic for the day. That is therapeutic, prophylactic, and diagnostic injections and infusions. Okay. So before we jump into these codes and the guidelines, we need to clearly understand one important concept. Yes, I'm talking about the difference between the infusion and injection. Because if you don't really understand this difference, infusion and injection coding might feel a little bit confusing. Okay, so let's start with the infusion. An infusion is a process of delivering a fluid, medication, or even sometimes a blood product slowly and continuously into the body over a defined period of time. All right. And here we are mostly dealing, yes, over a defined period of time. And it does not happen instantly. It runs gradually from like maybe along around 30 minutes, half an hour, 1 hour, 2 hours, and sometimes even longer. So infusion means slow, controlled, and timed. Just keep that in mind. And most of the infusions are administered intravenously, means through a vein, and sometimes, or some cases, certain medications may also be administered via subcutaneous infusion. And that depends upon the drug and the clinical scenario. Now, let's compare that with an injection. Okay, so injection is administration of medication or substance using syringe and needle, and it is typically delivered over a short period of time. And unlike an infusion, it does not run continuously. It is administered and completed within a short duration. So that's the main difference. And there are different types of injections based on the route of administration, like subcutaneous, that means under the skin, intramuscular, that means administered through the muscle or into the muscle, sorry, into the muscle, and intravenous push, which means medication is administered directly into the IV axis, that is intravenous axis, over a very short period of time. And it can be also by intra-arterial push, where medication is injected directly into the artery. All right, so remember, if short and quick, that would be injection or push. If it is slow and timed, that would be infusion. Okay, now let's clearly understand how a CPT defines an intravenous push and an intra-arterial push. So this is according to the CPT definition. So CPT defines intravenous push or intra-arterial push as an injection in which individual administering the drug is continuously present to administer the medication and observe the patient. Okay, so what does that mean practically? It means that the healthcare professional does not start it and just walk away, or does not hang it and leave. The healthcare professional will remain present, actively administering the medication, and also directly observing the patient during the administration. And the second definition or second condition which CPT states is that an infusion that lasts 15 minutes or less is considered as an intravenous push. Now, let me repeat that clearly. If a medication administered through IV tubing but runs 15 minutes or less, it is still classified as an intravenous push. Even if the document says intravenous infusion, short infusion, or infused via an IV line, if the total time is less than 15 minutes or 15 minutes or less, it is coded as an intravenous push. All right. So that is an important guidelines which you have to take a note of and remember. Okay, so let's move on. So I just skipped few slides. Let me come back. All right. So these are the infusion codes. You can see 96365. These are for intravenous infusion from 96365 through 96368. So 96365 is for intravenous infusion therapy, prophylaxis or diagnosis, initial up to 1 hour. Then you have 96366. That is an additional add-on code for each additional hour. And we have 96367 for additional sequential infusion of a new drug or substance up to 1 hour, and 96368 that is for concurrent infusion. Now, what is a sequential infusion and concurrent infusion? That we will be discussing on the upcoming slides. And we also have subcutaneous infusion codes from 96369 through 96371, and these are your injection code. 96372 is for therapeutic, prophylactic, diagnostic injection through subcutaneous or intramuscular route. We have 96373, that is for intra-arterial injection. 96374 through 96376, which is for intravenous push. All right, great. How are you all doing, coders? Let me know in the chat. So now we have covered the intravenous push, injection, and hydration. Let's move into some important general coding guidelines about these injections. Also about the chemotherapy. This include the chemotherapy guidelines as well, which will be also covered later in today's session. So let's build the foundation properly. First, CPT clearly state that hydration, therapeutic injection or infusions, and chemotherapy administration codes are not intended to be reported by the physician in the facility setting. That means these services are typically reported by the facility. Okay, and also if the physician performs a significantly separately identifiable E&M service on the same day as infusion or injection, then you can report appropriate E&M code with modifier 25 in addition to the appropriate infusion or injection code. Now, let's talk about what is included in the infusion and injection codes. And again, CPT clearly states that the following services are bundled and should not be reported separately. What are these services? It includes the use of local anesthesia, your IV start, access to an indwelling IV or subcutaneous catheter or port, standard tubing, syringes, and supplies. Also, flush at the conclusion of an infusion. All these services are included in your infusion or injection service. Now, here is one big guideline or rule in the infusion coding. Only one initial service per date of service. Only one initial service should be reported per date of service. No matter how many drugs are administered on the same day, you report only one initial code. Okay, so if multiple drugs are given as an infusions or injections on the same date, you select only one initial service based on the hierarchy for the facility reporting. Okay, and everything else should be reported as subsequent or sequential or concurrent codes depending upon the service that was performed. And only exception to this is when if the protocol requires two separate IV access or if two completely separate IV lines are medically necessary. And only in these circumstances you may report initial code twice. And also, in that situation, you append a 59 modifier to the second initial code to indicate that It was distinct procedure service performed at a separate IV site. All right. So that's an important guideline. All right. Now, in the previous slide, just a while ago, I just said that you report only one initial service code per date of service, right? Now, let's connect that rule to the physician reporting and facility reporting. So, when reporting for the physician or other qualified healthcare professional, the initial infusion is based on primary reason for encounter. So, it doesn't matter in what order or the services were provided or performed. It doesn't matter which one was started first and which one started second. What matter is that why did the patient come in? And that determines your initial service for the physician reporting. All right. Now, let's switch to the facility reporting. Now, facility reporting does not look at the primary reason for the encounter. Instead, it follows a structured hierarchy algorithm. Yes, and here is the hierarchy facilities must follow. First comes the chemotherapy, and it is followed by therapeutic prophylactic diagnostic infusion, which is followed by therapeutic prophylactic diagnostic injection. Then comes the hydration. So remember this clearly. Infusions are primary to the push, pushes are primary to the injection, and injections are primary to the hydration. And that is the structural hierarchy used in the facility coding. I hope this pyramid will help you to memorize the hierarchy. So, first comes the chemotherapy, then comes infusions, pushes, injections, and then comes the hydration service. Okay, so let's walk through an example and compare the physician reporting versus the facility reporting. All right, so join with me in the chat, coders. You can type your answers in the chat. Okay, so here is the question. A patient presents to the physician's office for treatment of a bacterial infection, and during the visit, physician also administers an IV push of ondansetron to prevent the nausea associated with the antibiotic. And the timings are 10:15 a.m. to 10:20 a.m. is the time when your IV antibiotic push is given, and 11 a.m. to 12 p.m. is when your IV anti-nausea medication is given, and that's given as an infusion. All right, coders, let me know in the chat how will you report this for a professional service or for a professional or a physician reporting. Let me know in the chat. Okay, you can take a couple of seconds or a couple of, yeah, you can take few seconds. Give your best answers based on the guidelines which we reviewed. So for a physician report, the initial code must be based on the primary reason for encounter. And now you have to think what was the primary reason for the patient's encounter in this scenario. All right, go ahead and place your answers, and I will walk you through this one. Okay, so here the patient was present in the physician's office for the treatment of a bacterial infection, right? And physician administered ondansetron just to prevent the nausea. So the primary reason for for the encounter was for an antibiotic treatment for the bacterial infection, right? So here the primary reason for the visit was antibiotic push. So we would give 96374 as your initial antibiotic push code, and then we use an add-on code 96367 for the IV anti-nausea medication, which is their infusion code. All right. So the primary reason for the encounter was antibiotic, and that was given as an push. And what is the code for the push? It would be 96374, followed by add-on code 96367 for a sequential infusion of anti-nausea medication. So this was for a physician reporting, right? Now let's move on and let's see how would you report for a facility. Okay, here is that that's the same scenario. Here the patient presents to the hospital for the treatment of bacterial infection, and during the visit, physician also administers the IV push of ondansetron to prevent the nausea associated with the antibiotic, and the timings are also same. Okay, you have 10:15 a.m. to 10:20, that is for IV antibiotic push, and 11 a.m. to 12 p.m., that is for IV anti-nausea medication, which is given as an infusion. So how would you report for this for a facility reporting? And remember, for the facility reporting, you should follow the hierarchy, or the hierarchy which I've mentioned. First comes the chemotherapy, then comes the infusion, then comes your push, injection, and hydration. So if you no worries if you don't want you if you feel that you can just mention which one should be coded first. No need to mention the CPT code. Okay, I can see some answers coming in. Great. Awesome. Yes. So, okay, I'll give you a couple more seconds. You can just mention which one will be reported first. Mm-hmm. All right, your CPT codes are also here. Okay, so the first would be infusion code, right? We are coding for the facility. And I can see that there was an infusion given and an IV push, IV infusion and an IV push. So let me look into the hierarchy. First comes the infusion, followed by the push. So first you should report the initial code for the infusion, that is for IV anti-nausea medication. That would be reported with 96365, and that is followed by your push code, IV push code. That would be 96375. All right. So that's how you report for the facility. There you go. Great, great, great answers. Okay, so it's clear that uh, I can understand that the concept is clear. So good answers. So that's how you report for the facility. And now let's move on. Now let's move on to the next important definitions. We are going to look at what sequential infusions or sequential push are. So you just saw before in the previous slide there was a code for sequential infusion and sequential push, right? So this is what a sequential infusion or push is all about. According to the CPT, the sequential infusion or push occurs when a different, meaning a new drug, is administered after the initial infusion or push has been completed through the same IV line during the same encounter. Okay, now, okay, I will simplify that. So, sequential infusion or sequential push means that first drug finishes. So, the physician gives you the first drug, it is completed, and then a new drug is started. And that is started using the same IV access, and it occurs during the same visit as well. So that combination is what makes it sequential. So the key concept is different drugs, same IV line, same encounter. All right. Now here is where it gets interesting. There is an important exception to this new drug rule, but this applies only to the facility reporting. So for the facility coding, even if same drug is given again through the same IV line during the same encounter after the initial administration, you may still report it as a sequential push using the CPT code 9636376. Okay, I can show you that. Okay, you will better understand seeing the CPT code. So here you can see there is a CPT code add-on code 96376, that is for intravenous infusion therapy prophylaxis or diagnosis for additional sequential infusion of a new drug or substance up to 1 hour. Okay, so this is a sequential code for the infusion, and you will find 963. Okay, you will find 96. Give me a moment. Okay, my on clicks are not working. All right. So you will find 96375, that is for each additional sequential intravenous push of a new substance or drug. So this is your sequential add-on code for intravenous push. Okay, and here comes the third one, which is 96376, that is for the sequential intravenous push of same substance or drug provided in a facility. And this code is exclusively for facility reporting only. You can see it from the code language itself. Okay, so that's what I said. And there is a catch here as well. What is that? That means that 96376 cannot be reported if the second push of the same drug is given within 30 minutes of previous push. All right. So if one drug has been given and same drug has been repeated within 30 minutes of time gap, in such cases, you cannot report 97376. All right. I hope the explanation helped. Now let's move on to the next definition, concurrent infusion. So, what's a concurrent infusion? Concurrent infusion occurs when new drug is infused at the same time as another drug. Okay, and it is infused through the same IV access during the same encounter. So you can see two drugs which has been infused at the same time through the same IV access, right? So unlike sequential where one drug finishes and another begins, concurrent means that they are running simultaneously at a time. All right. So two medication, same IV line running at the same time. That is concurrent. And now here are important rules for concurrent infusion. You can first the concurrent infusions are reported only once per day, even if multiple drugs run concurrently. You report only one concurrent code at a time. And second, hydration can never be reported as concurrent. So let me say that clearly. Hydration is not considered as concurrent infusion. So if the fluids are running alongside another infusion, they are considered supportive and not reported as concurrent. And here's the second big rule, that is third concurrent drug is not reported separately. So for example, let's say drug A is the initial infusion, drug B runs at the same time, so you report concurrent codes for the drug B, right? Now, again, if drug C also runs at the same time, you don't report another code for the third drug or for the drug C. Only one concurrent uh, service code per date of service should be reported, right? Yes, so it's already mentioned in the parenthetical guideline. Report 96368 only once per date of service, and that is your concurrent infusion code. Are we good, coders? Let me know in the chat. Are we good so far? Okay, all right. Because we are going to move on to the final and important category, that is the chemotherapy administration. All right. So when we talk about the chemotherapy administration codes, we are referring to the CPT codes ranging from 96401 through 96459, and these codes are reported for the parenteral administration of antineoplastic drug and other highly complex biologic agents. And even when they are also used for non-cancerous diagnosis. So remember, it's not just about the cancer, it's about the complexity and risk or level of the drugs being administered. So why why is chemotherapy coded separately? So chemotherapy administration is not coded like the regular therapeutic infusion because it carries a higher risk of severe reaction. You know, these are highly complex medication, so they always carry that higher risk of severe reaction, greater potential of toxicity as well, and more intense patient monitoring, advanced staff training requirements, direct supervision, frequent communication between the nurse and the physician, and also possible infusion rate adjustment. So, this is not your routine infusions. This is high risk, high complexity administration. And that is why chemotherapy services are placed at the top of the infusion hierarchy. So, you saw on the previous slide that chemotherapy comes first. So this is one of the main reasons. And the chemotherapy administration codes also include your preparation of the chemotherapy agent, preparation of highly complex biologic agents, also administration of those agents. So you don't want to report the preparation when using chemotherapy administration code. It is bundled. And if medications such as antibiotic, steroid, antiemetics, or some analgesics are administered independently or sequentially, you can report them separately, okay, using the therapeutic administration code. So they are reported separately. And if a chemotherapy is delivered through regional perfusion, so in those circumstances, you use the intra arterial, so you use arterial infusion codes that is ranging from 96420 through 96425. Okay, now these are your chemotherapy or chemotherapy codes, as well as the high complex drug and high complex biological agent administration codes. You can see they ranges from 96401 through 96459. And first you can see the codes for subcutaneous and intramuscular injection in 96401 and 96402. They are based on if it is non-hormonal or hormonal antineoplastic drug. Then you can see classification of intralesional injection. They are 96405 through 90406. Then comes intravenous push codes, which is 96409, and you have an add-on code 96411. All right, and also sequential infusion code, which is 96417. Okay, and here are some other codes as well. You have intra-arterial chemotherapy codes ranging from 96420 through 425. Then you have other injection and infusion codes. So if chemotherapy administration is given to the pleural cavity, that specific region, you have codes 96440. Similarly, if it is given to the peritoneal cavity, you have 96446. If it is given to the CNS, you have code 96450. All right, and there are also codes for the port implantable pump when a portable or implantable pump is involved as well. Okay, so there are different codes for them as well. Now, let's talk about something that is advanced and very unique under the chemotherapy coding. So that is HIPEC, which stands for hyperthermic intraperitoneal chemotherapy. So this is not the routine intravenous chemotherapy. HIPEC is heated chemotherapy treatment, which is delivered directly into the abdominal cavity, and it is usually performed during the surgery. So I will simplify them. Okay, so during an open abdominal procedure, the chemotherapy is circulated inside the abdomen using special catheters. So the solution, the chemotherapy solution, will be heated because the heat will enhance the effectiveness of the chemotherapy agent. Okay, and think of it as surgery plus heated chemotherapy circulation inside the abdomen. Yeah, so it's a bit of a complex procedure, and you can see different procedures that are included in the HIPEC procedures. So I'm not going to read all of them. You can see all of them. It's listed in your CPT manual. And the codes which is used to report HIPEC procedures are 96. These are add-on codes. They are 96457, which is for first 60 minutes, and we have 96458, that is for each additional 30 minutes. And it is very important to note, as I said, these are add-on codes, and they must be reported in addition to the primary surgical procedures. All right. Okay, so that's okay. That's all about the instructional part. And once again, I want to just remind you about the hierarchy chart for these infusions and injection procedures. So first comes your chemotherapy infusions, followed by your chemotherapy intravenous push. Third comes the chemotherapy injection. So that's your chemotherapy procedures. Now this is followed by the therapeutic prophylactic diagnostic infusions, which is the fifth one would be therapeutic prophylactic diagnostic push. And then comes therapeutic prophylactic diagnostic injection. And finally, your hydration service. So hydration comes at the last, all right, even though we discussed it the first. Okay, so this is your hierarchy chart. Hope this helps you in decision making of which primary code to be used. All right. Okay, coders. Now it's time for us to do some coding exercise. All right. And here goes the first question. I hope you all are ready and you're ready with your CPD manuals. Okay, coders. This is the first question. Of the following answers, which best describe the hydration administration services? Your options are option A 96360, 96361 times 3, option B 96360, 96361, option C 96360, 96361 times 2, option D 96365, 96366 times 3. All right, a patient present to the hospital, outpatient department with severe dehydration, due to food poisoning. The physician evaluates a patient and orders IV hydration therapy. Normal saline is administered from 1 p.m. to 3:30 p.m. No other infusion, injections, or chemotherapy services are performed. Infusions is continuous and documented. Of the following, which best describe the hydration administration service? And coders, give your best try. You can place your answers in the chat. It's fine if you get it wrong. Give your best answers. Okay? And your time has already begun. All right, Chorus. That's time. I can see some answers in the chat. If you're still working, don't worry. Keep on working on the scenario. I will walk you through this one, and yeah, you can also watch the playback. And if you get it wrong as well, okay. So don't worry if you get it wrong. We are going to break down the scenario together. Okay. So let's first look at the inventory. What do we have here? We had an hydration therapy, right? Yes, we had a hydration therapy. Just give me a second. Okay, so we had an hydration therapy, and the timing was from 1 p.m. to 3:30. So you have to calculate the duration. So between 1 p.m. to 2 p.m. we have 1 hour. Between 2 p.m. to 3 p.m. we have again one more hour, and from 3 to 3:30 there is 30 minutes, right? So total you have 2 hour and 30 minutes of hydration therapy given. Am I right? You agree with me? Yes. Okay. So that's 2 hour and 30 minutes. Now let's look at the code options. Option D is coding for 96365 and 96366 times 3. So 96365, as I said, these are not for hydration therapy. These are for your therapeutic, prophylactic, or diagnostic IV infusions. So they are not for hydration, right? So you cannot code option D here. So straight away, I can see it is wrong answer. It's from the wrong category. So it's not option D. Now between option A, B, and C, all the three options are coding for the same CPT code. Only the quantities differ. So option A is coding for 96360, right? That is for intravenous infusion, hydration, initial 31 minutes to 1 hour, and 96361 is for each additional hour, right? Okay, so in option A, I can see that it has 96360, which is for the first hour, and you have 96361, that is times 3. So if you say it's times 3, that means total 3 hours are included in 96361. So in option A totally codes for 4 hour of IV hydration, right? And let me check with my inventory. I can see that I had only 2 hour and 30 minutes. So option A is wrong because that's for 4 hour of hydration therapy. We didn't have 4 hour of hydration therapy. We had only 2.5 hours. So option A is incorrect. Option A has to go. Now we are between option B and option C. All right. So I can say option C is incorrect in this scenario. I will say why. Okay. So 96360 is coding for the first hour of IV infusion hydration, right? And 96361 is coding for each additional hour. That is coding for your second hour of IV hydration. Now, what is your how many times are left? How many minutes are left? We are covered already for 2 hours. Now we have 30 more minutes left out of 2 hours and 30 minutes, right? So the guidelines, if you look at the parenthetical guideline, also it states that report 96361 for hydration infusion intervals of greater than 30 minutes beyond 1 hour increment. So also we studied that you need 31 minutes minimum in order to report a hydration service code, right? So we had only 30 minutes remaining. So if that was 2 hours and 31 minutes, you could have quoted one more quantity of 96361. But here we had only 2 hour and 30 minutes of hydration given. That eliminates option C and it makes your option or B as the correct one. I can see some of the good correct answers in the chat. Okay, Curtis, if you had an aha moment, let me know. Let me know in the chat. All right, so let me move on to the second question. Of the following answers, which best describe the facility administration service? Option A 96374, 96361, option B 96365, 96361, option C 96365, 96360, option D 96360, 96365. A 32-year-old patient presents to the hospital outpatient department with dehydration secondary to the food poisoning. IV access is established at 1 p.m. The hydration with 1 liter of normal saline is initiated at 1:10 p.m. and completed at 2:10 p.m. The intravenous infusion of ceftriaxone is then started at 2:15 p.m. and discontinued at 2:45 p.m. The patient is monitored throughout the encounter and discharged in stable condition. Of the following answers, which best describe your facility administration service? So we are coding for the facility, and you can place your answers accordingly. Go ahead, Curtis. Yes, I can see some people are even explaining why, for the previous scenario, why you picked the option B as the correct one. So great, great, great answers. Wonderful. All right, Curtis, you can place your answers in the chat for the scenario number 2. All the best. All right, Codus. It's almost time since we are running out of time. I will walk you through this one. Please, as I said, please continue to work on it if you're working still working on this exercise. So I will just walk you through this one, and please let me know if my explanation helped. Okay. So let's begin by looking at the inventory list here. So that's my first step. Get your inventories right. So here we have a hydration therapy given from 1:10 p.m. to 2:10 p.m. Okay, and IV infusion of ceftriaxone also given from 2:15 p.m. to 2:45 p.m. So we have hydration therapy that has been provided for 1 hour, and you have IV infusion of ceftriaxone, which is given for 30 minutes, right? 2:15 p.m. to 2:45 p.m. That's 30 minutes of IV infusion therapy as well. Great. So that's what we have. Now let's look into the CPT codes. Option A, that is coding for 96374. I can see this is straight away. This is a wrong answer because we had an IV infusion of a ceftriaxone for 30 minutes, right, from 2:15 p.m. to 2:45 p.m. And 96374 is coding for intravenous push. So if you remember what I said in the beginning, intravenous push are short and they are not timed, like they are not time and they are not given for a long period of time. So intravenous push are also those injection which are infusions of less than 15 minutes or less than that, right? So we here had a intravenous infusion of 30 minutes. So that means this is for infusion. We have to code for the infusion, not for intravenous push. And it makes your option A incorrect. 96374 has to go. That's not what we are looking for. We are looking for a infusion and a hydration CPT code. Okay, now we are left with option B, C, and D. Option D. Option D is coding for 96360 and 96365. So 96360 is for intravenous infusion hydration of initial 31 minutes to 1 hour, right? Okay, now Codus. If you remember, I would say option D is also incorrect because if you remember, we have to follow a hierarchy for. Uh, okay, I was just looking at the chat. Yes, so we have to follow a hierarchy for the facility reporting, right? So we are looking at the question was for facility administration service. So the hierarchy states that when you have infusions, hydrations, injections, given first and chemotherapy also given first preference or first one in the hierarchy would be the infusion. So you have to pick the primary code for the chemotherapy that is followed by your infusions, which is followed by your IV push, which is followed by your injection. All right. So and then comes the hydration. So in our scenario we had IV infusions and IV hydration therapy. Okay, so out of these two, which comes first in your hierarchy? Let me know in the chat. Which comes first? It is IV infusion, right? Yes, IV infusion comes first. So the primary code should be for an IV infusion of ceftriaxone, which is given for 30 minutes. So it should not be 96360. And the second code should be the add-on code for your hydration. All right, so that makes option D incorrect. And moreover, option D is also coding for two primary codes, right? So I would say option D is incorrect in this scenario. Okay. Okay. So option C is also incorrect because it is coding for 96365 and 96360, which is almost same as option D. There are two primary codes. That's also incorrect. And the correct answer is going to be option B, which is coding for your first IV infusion ceftriaxone 96365, which is from 2:15 p.m. to 2:45 p.m. And then your second code, that is a hydration code, which is the add-on code for each additional hour. That would be 96361. Yes, yes, you're right, Miss Rosa. Miss Rosa is saying aha moments are the best. And I can see a lot of great answers as well. So coders, let me know. Did the explanation help? It looks like you all doing a great job so far. Okay, let me know in the chat coders. Let me know. So in meanwhile, I will move on to the third exercise. And the question is, of the following answers, which best describe the facility administration service? Options are option A, 96374, 96376, option B, 96374, option C, 96376, option D, 96374, 96375. A 48-year-old patient presents to the hospital outpatient department with acute migraine and nausea. The IV access is established at 9 a.m. The patient receives the intravenous push of ondansetron at 9:10 a.m. The administration is completed at 9:12 a.m. Due to continued nausea, a second intravenous push of ondansetron is administered at 9:30 a.m. and completed at 9:32 a.m. The patient is monitored and discharged in stable condition. Of the following answers, which best describe the facility administration services? Codus, you got 2.5 minutes. I think you don't need 2.5 minutes to complete this one. Go ahead, give your best answers. Continue what you have been doing. You all are doing a outstanding job. All right, all right. So that's time. So you can see a few answers in the chat. Good, good. So it's going to be this is a great scenario. Okay, so you might have an aha moment here as well. So let's see. Okay, first let's get the inventory list. In inventory, I have intravenous ondansetron that has given that was given at 9:10 a.m. And it ended at 9:12 a.m. Right? And again, we have intravenous push of ondansetron given at 9:30 a.m. And it ended at 9:32 a.m. So we have two same medication, which is given at two different times. All right. So remember something, Codis? Something coming to your mind from what we have learned? What kind of infusion is this? Or what kind of push is this? Remember, these are sequential administration, right? Remember the definition? All right. All right. Great. So let's look into CPT codes. Option C is coding for 9636376. Now, 96376 is an add on code. Yes, it is coding for the sequential intravenous push of the same substance or drug, provided in the facility, but this is an add-on code, right? So can we assign add-on code just like that? No, we cannot. They should be coded along with the primary code. They are not to be coded as primary codes. You cannot assign them as a primary code, right? They are not standalone codes. So option C is incorrect, right? That's something which got my attention at the first. Okay, now we have option D that is coding for 96374 and it is for the intravenous push of a single or initial drug substance. That's a good code in therapeutic, prophylactic or diagnostic injection intravenous push single or initial substance or drug. So that's good code selection. And next one is coding for 96375. Now that is coding for each additional sequential intravenous push of a new substance or drug. Now, did we have a new drug here? Let me know. Did we have a new drug? No, we had the same ondansetron given, right? It was two same drugs. So you cannot report 96375 in this scenario, right? Oh, okay. Now we are left with option A and B, and I can see that most of the split was between this option A and option B. All right, coders, hang in tight. Here comes the aha moment. I would say option A is incorrect. Why? Because you have to look at this parenthetical guideline over here. Okay, so it states that you should not report 96376 for a push performed within 30 minutes of a reported push of the same substance or drug. Okay, so if the same drug was given within 30 minutes of the previous administration, you cannot report them. And my inventory says that I had a drug infusion started at 9, push started at 9:10 a.m., ended at 9:12 a.m., and the other one was started at 9:30 a.m. So what's the difference between these two times? It happened within 30 minutes time interval, right? Yes, it happened within 30 minutes of time interval. So, as per the guideline, we cannot report 96376 at this scenario, and the correct code would be 96374, and that would be option B. All right. What say you, coders? Did the explanation help? I know that is going to be an aha moment. Was that an aha moment? That's why I put the banner be forensic just when we were answering the scenario. All right, coders. Let me know in the chat. Quickly, let me know in the chat. Did the explanation help? And if it helped, please type in aha moment. Yes, aha in the chat as well. Okay, so let me quickly move on to the exercise number 5. Of the following answers, which best describe the facility administration service, your options are option A 96365, option B 96365, 96361, option C 96374, option D 96374, 96361. A 45-year-old patient presents to the hospital outpatient department with acute migraine. IV access is established at 3 p.m. An intravenous infusion of ketorolac diluted in small amount of normal saline is initiated at 3:10 p.m. and discontinued at 3:20 p.m. The patient is monitored for response and discharged in stable condition. Of the following answers, which best describe the facility administration services? And coders, your time begins now. All the best. All right, coders. So that's your 2.5 minutes. Okay. I can see Mr. Devendra Patel. He's having a great, great, great time in the chat. I think you got all the four questions right. Great job, great job. All right, so let's start reviewing the scenario we have in inventory list. An intravenous infusion of a ketorolac that is given from 3:10 p.m. to 3:20 p.m. Right? Okay. Now the CPT code, the option D and B is coding for a CPT code 96361. And that is for initial or that is for intravenous infusion hydration each additional hour. Now, Curtis, I can see that yes, intravenous infusion of ketorolac was diluted in a small amount of normal saline, right? But can we report 96361 in this scenario? No, we cannot report because in the beginning we reviewed the guideline that if a normal saline has been given just to dilute the therapeutic infusion or the drug, you cannot report them separately, right? Yes, they are considered inherent to the primary infusion codes. You cannot report them separately, and that makes your option D and option B incorrect. And now we are left with option A and C. So straight away I eliminated option B and D because I know that the guidelines does not allow it to code in this scenario. Okay. So option B and option D is incorrect. We are left with option A and C. All right. Now here comes another guideline. And the guideline states that yes, as per the CPT, one of your criteria for billing IV push is that an infusion. You can see the second one over here. Let me just mark it. Okay, over here, option the B. The B. It states that an infusion of 15 minutes or less will be considered as a intravenous push. Right? Yes, over here it's saying intravenous or intraarterial push can be defined as an infusion that is less than or equal to 15 minutes. And that makes us calculate the time period for which the intravenous infusion of ketorolac is given. So I can see it was administered from 3:10 to 3:20. So that's total 10 minutes of intravenous infusion of ketorolac. So even if it is an infusion, if it is given just less than or equal to 15 minutes, you should report them as an intravenous push. And 96365 is coding for intravenous infusion therapy. No, here in our scenario, it would be considered as intravenous push. And that makes option C 96374 the correct answer, which is coding for your therapeutic, prophylactic, or diagnostic injection intravenous push, single or initial substance. Okay, Goddess, let me know. Did the explanation help? And let me know how are you all doing. Okay, so let's move on. I have some rapid questions for you all. Okay, it's not poll time, it's a rapid question. So we are almost towards the end, and these questions are based on the guidelines. So, coders, grab your CPT manual, and here's your first question. So, answer them quickly, answer them rapidly. The first question: what is the minimum time duration required to report a hydration infusion IV infusion service? Options are option A is it 15 minutes, option B is it 31 minutes. Okay, oh my god, I can see the answers already in the chat. Great, great, great. Option C 60 minutes, option D 16 minutes. What say you, coders? Excellent, excellent. All right. Okay. All right. So we are looking at the minimum time duration required for a hydration IV infusion. All right. So that should be 31 minutes. Right? Yes. A minimum duration of 31 minutes of hydration infusion is required to report the service, the hydration service. So great job, coders. Next one, let's see how are you going to do on this one. Which of the following answers or following services is considered included in infusion or injection and should not be reported separately? Is it option A, an additional sequential infusion? Option B, a therapeutic drug being administered? Option C, an IV start and a flush at the conclusion of the IV of the infusion? All right, Coders, quickly let me know what you learned from today's session. I see that I'm missing one more option. Option D is missing in this. Okay, you have only three options: option A, B, and C. What say you, Coders? Go ahead, go ahead, go ahead. Give your best answers. All right, I think you all are thinking on this one. So this is a rapid fire scenarios or rapid fire section. Okay, now I can see the answers are coming. Absolutely right. It is option C, and you can see it's mentioned in our guidelines as well. Yes, the general guidelines. It says that IV shot and flush at the conclusion of an infusion, they are included and cannot be reported separately. Question number three. An intravenous push is defined as an injection where healthcare provider is continuously present or infusion lasting for how long? And options are option A 15 minutes or less, option B 16 minutes to 30 minutes, option C exactly 1 hour, option D 31 minutes. So P forensic coders, don't get tricked up by the question, read the last portion of the question first, and you can answer it correctly. All right. Okay. Excellent. Any more answers? Excellent. Excellent. All right. Great. Yes. Option A is the correct answer. 15 minutes or less. And here is your guideline. Intravenous or intraatrial push is defined as an infusion of 15 minutes or less. Fantastic job. You all are phenomenal. You are doing a phenomenal job. Next question. How should you report the intravenous infusion that is run solely to keep open an IV line before or after therapeutic infusion? Option A, it is coded as initial hydration service. It is coded as concurrent infusion. Option C, it is not coded or reported separately. Option D, it is coded as an add-on code for hydration service. What say you, coders? What say you? What do you remember from the guidelines which we learned? Okay, all right. Any more answers? Okay, great, great, great. Yes. Spot on once again. It's option C. Yes, it says that absolutely correct. Yes. It says that if it's mentioned like or if a hydration is given to keep open or keep the IV line open, it is not separately reported. Great. Okay, I think this is a last rapid fire question which I have for you. When a facility is reporting multiple types of services on the same day, which type of service is considered primary in coding hierarchy? Option A, therapeutic infusion. Option B, chemotherapy services. Option C, hydration service. Option D, therapeutic push. Okay, when a facility is reporting multiple types of service on the same day, what type of service is considered primary in coding hierarchy? All right, you guys are on fire. Yes. So I think you all have learned a lot today. Option B is the correct answer. And you all did a fantastic job, coders. Here you go. Here's your hierarchy guideline. Chemotherapy comes first, followed by your therapeutic prophylactic diagnostic services, and then comes your hydration. All right. Fantastic job, coders. I can see you all learned a lot and you were all reproducing them for your scenarios as well. So, coders, if you enjoyed the video, please don't forget to like that smash that like button, and subscribe to AMCI channel. Share this content with someone who really need to see this, someone who's preparing for the exams as well. Thank you, Miss Mills, for placing the link in the chat. Thank you, Miss Rosa, as well, for joining with us. Thank you, Miss Mills, and thank you, Miss Rosa. Thank you, coders, for joining today. And I hope this was one of the most demanded topics, and I hope it helped you and it helps you for exam and for your coding career ahead as well. So thank you once again, and we will be back next week with another great topic and great scenarios as well. So till then, coders, keep coding, stay safe, and see you all next week. Please don't forget to fill out the survey form. Also, hit that like button. All right, see you all next week. Goodbye.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. 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 AMCI.